What are local anesthetics? Local anesthetics are the drugs given as solutions of various strengths into a tissue by a injection or a block to block the pain sensation in the supplied area. What are the benefits of local anesthetics? They cause minimal respiratory and cardiac side effects. They are generally considered safe. They provide very good intraoperative and postoperative analgesia with minimal blood loss. Therefore, the surgical outcomes are often better when a case is done under local anesthesia. How do these local anesthetics act? They act by blocking the voltage gated sodium channels. Blockage of these channels prevents transmission of sodium ions. This will prevent transmission of pain impulse along the pain fibers. What are the factors that influence the action of local anesthetic? The pKa value, the lipid solubility and the protein binding ability of the local anesthetic will decide the potency and the duration of action of local anesthetic. Local vasodilation will enhance the action of local anesthetic. It will allow the local anesthetic to be there for a longer duration, thereby increasing its action. The tissue pH plays a vital role in the action of local anesthetic. The tissue pH can get altered, especially in case of systemic or local infection, which will reduce the action of local anesthetic. Local anesthetic agents are classified based on their chemical composition. They can be esters like procaine, chlorprocaine and tetracaine, or they can be amides like lignocaine, prilocaine, mepivacaine, bupivacaine, etidocaine and ropivacaine. Among these, lignocaine, bupivacaine and ropivacaine are commonly used in our operation theatre. Let us see individual properties of these popular local anesthetic agents. Lignocaine is a amide type of local anesthetic. It has got intermediate duration of action. The action due to lignocaine is rapid in onset and it produces a dense motor block. So, when you want to give a brachial block or some peripheral nerve block, we use lignocaine if you want to see the action rapidly. The maximum allowed single dose of lignocaine is 7 mg per kg. So, if you cross this, there is always chances of lignocaine toxicity. As you can see, it is available in 2% form, 4% form, 2% with adrenaline and also available for spinal anesthesia. It is also available in jelly forms. Moving on to the next agent, that is bupivacaine. Bupivacaine is a long acting amide type of local anesthetic. It produces a dense sensory block at low concentrations. Again, when you want to give block, you can use both bupivacaine and lignocaine in a mixture to get the best block. Accidental rapid IV injection of bupivacaine can be cardiotoxic and the patient can have sudden circulatory collapse. Bupivacaine produces a rapid onset action and the maximum allowed single dose of bupivacaine is 3.5 milligrams per kg body weight. Bupivacaine is commonly used for nerve blocks in its isobaric form, whereas for spinal anesthesia we use hyperbaric bupivacaine. The next agent is ropivacaine. Ropivacaine is again a amide type of long acting local anesthetic. Compared to bupivacaine, it causes less cardiotoxicity, but it is contraindicated in intravenous regional anesthesia. The maximum single dose of ropivacaine that is allowed is 3 milligrams per kg body weight. Coming on to the next set of agents, that is topical anesthetic agents. What are these topical agents? These are the drugs that are topically applied over the skin and the mucous membranes to block pain sensation in that particular area. Examples for topical anesthetics include the Emla cream, the lignocaine spray and the jelly proparacaine topical eye drops. We will learn few important points about these drugs individually. First among these is EMLA. EMLA is eutectic mixture of local anesthetic agents. It is a mixture of 2.5% lignocaine and 2.5% prilocaine in emulsion. These are topically applied over skin before a procedure. In children, about 1 to 2 gram is applied about 30 to 60 minutes before IV cannulation to prevent pain of cannulation. The depth of analgesia produced is about 5 millimeters and the analgesia lasts for about 2 hours. The next agent is lignocaine spray and gel. By standard, lignocaine is available as 4 to 10% aerosol spray and a 2% gel. It produces topical anesthesia of skin and mucous membranes when used before procedures. It is useful for endoscopy, laryngoscopy, bronchoscopy, colposcopy and other procedures where instrumentation is involved. We can use lignocaine spray for producing topical anesthesia at the site of IV cannulation in children similar to the EMLA cream. Lignocaine jelly can be used over the minor burns, scrapes and insect bites to block the pain. Coming on to proparacaine drops. This was recently asked in your INI-CET. Proparacaine drops are amino ester topical anesthetic agents with a rapid onset of action. The action is within 2 to 3 minutes of putting the drops and it lasts for just 10 to 20 minutes. So, they are short acting. These are useful as eye drops for ophthalmic procedures like tonometry, gonioscopy and corneal and conjunctival procedures including foreign body removal.